Good morning. Good to see you, everyone. Hi, I'm Dr. Binyo. My specialty is combined with Western and conventional medicine and Eastern medicine to help our patients reverse chronic disease. I've talked about how to cure migraine last time. Today, I will talk about how to cure impotence or erectile dysfunction. Next week will be Father's Day. I would like also talk about how to improve prostatitis and high cholesterol hypertension as well. So erectile dysfunction has been affected how many people? It's been affected 52% of people between age 40 to 70 years old. So to cure erectile dysfunction, number one, you really need to understand what can be cured, what cannot be cured. So you have to talk to your physician, your healthcare provider, to identify the cause of the problems. Some of the impotence cannot be cured, such as if they have spinal injury, nerve damage, or they have prostate surgery or major radiation. Some of the, even this group, we can utilize some device to help the patient to achieve success sexual life. So understand erectile dysfunction, you gotta understand the anatomy. If you can see here right there. So the sensory nerve from the male organ is from the surface going to the S2, sacral 2, 3, and 4. So that's the sacral 2, 3, and 4. And then you have the parasympathetic nerve, which coming out from where? Coming out from S2 and S4, going to the male organ areas. Then you have sympathetic nerve coming out from T12 and go down to number 2. T12 means number thoracic, the 12th thoracic and the number second number vertebrae. Those nerve ending goes on, the sympathetic nerve going down to male organ areas. So anywhere you have injury, you may have erectile dysfunction. That's the reason it's important to identify what's the cause of the problems. Next thing you can understand that is you gotta have a good testosterone level. Testosterone is to maintain a healthy sperm and healthy libido. If the testosterone level is too low, that'll be a big problem. So that's an endocrine issue. The endocrine issue could cause by what? The brain areas, hypothalamus, pituitary, and the testes, these different places. So you really need to understand what's going on there. Next thing is the circulation. So the circulation going to the male organ, including if it's caused by what? Atherosclerosis. So if you have high cholesterol, you have calcified the arteries or hardened arteries, and you're gonna have problem influx, the blood flow into the male organ areas. Now, by the way, if your friends or someone had erectile dysfunction, from medical statistics, it shows that if a person had erectile dysfunction, about 65% of them, they may have a heart problem. Yes, they may have a heart problem. So you really need to find out the cause of the problems. Anyway, now we're going to talk about how it works. So if you look at the flower orchid right here, it looks great because it has good circulation, so you got to have a good circulation. And second, you got to have good sensory on the surface, so the plants will be sense the light, so they will produce the food. So that would be nerve situation. And number 3, you got to have a good soil. The soil areas is you got to have a balanced nutrients right there to maintain a healthy circulation and for the endocrine system, the testes, and different places. So let's talk about it. Another thing is that how about the psychologically? Yes, because stress and psychological stress can cause a lot of issue right here. So the caring, you take care of the plants and you talk to the plants actually can grow better. Yeah, that makes a lot of sense. So let's talk about another cause, heart disease. What disease can cause erectile dysfunction? Number 1 is heart disease. So many of them. Obesity, diabetes, what else? Prostate problems, hypertension, and no HDL. If the HDL is too low, that's going to be a problem right there. So now the medication can cause erectile dysfunction. Many of them. Number one, diuretics. Some of the diuretics, some of the hypertension. And then what else? It will be the antidepressant, tranquilizer. What else? It's the H2 antagonist. It's like some of the acid reflux drugs, ranitidine and cimetidine. Hormone like progesterone, estrogen treatment, and those can cause those issues. Cytotoxic treatment like the cyclophosphate and methotrexate, anticholinergic, and of course the drugs and alcohol all can cause all the issues. Finally, let's talk about the treatment. So I would like to talk about how to cure erectile dysfunction naturally, but with the invention of Viagra, it helped more than 60% of our men. It works very, very good. Its name is a PDE5 inhibitor. So that will increase the Nitric oxide level. So this drug is to suppress the enzyme to break down the nitric oxide. It works very, very well. The side effect is that if the person has heart disease, if the blood pressure is too low, this person, he definitely should avoid that. Okay. Next one, testosterone. A lot of people, they have testosterone injection to increase the muscle mass, which is good, but it has a link with causing prostate cancer, infertility, and heart disease. The third treatment for erectile dysfunction medically will be penile injection. So before the sex, and they can inject certain medication on the male organ areas. Number 4 is that it also could be very helpful to the age of 75 or 80-year-old really having a hard time erection. If they surgically qualified, they can have implant into the male organ, which is actually 2 of my patients have done that, and they really enjoy the outcome. So to cure your erectile dysfunction, number 1, you need to understand, work with your doctor to see if it's curable, to find the cause. Number 2 is that you really need to do exercise, weightlifting. So we actually design exercise for our patient based on whatever the hormone problem is, and then also we may teach the patient to do penile exercise specific one. The third one, the patient also can use vacuum pump. Vacuum constriction pump works very good. Number 4, PRP, platelet-rich plasma, could be injected in the penile areas to enhance the vasculation, the blood vessels and the circulation. It works well. Number 5 is stem cell treatment. As you know that your stem cell gonna decline dramatically after 35-year-old. The stem cell, infusion stem cell, we see very good results. Now acupuncture is amazing treatment. Acupuncture is working on the blockage of your nerve system, all those energy points I already mentioned about that. So that's for the respiratory, the heart, liver, pancreas, spleen, some ovary, testes right over here. So when you're using acupuncture, you can reconstruct the circulation for the whole body. And finally, a lot of you are interested about herbal supplements. Herbal supplements are very easy to access, but be very careful. Like one thing, if you look at that, is L-arginine. L-arginine is the precursor of nitric oxide. So this is a good one, but if you're taking Viagra, don't take this one together, okay? You have to talk to your doctor. And DHEA is a good choice, increase libido for women, and also help erectile dysfunctions. Ginkgo is another good one. And other herb like African yohimbine, ginseng, rhodiola, rosea, horn goat, wheat. Those are the several herbal supplements you may try, but you have to talk to your doctor. Like ginseng, absolutely you should not use if you have a high blood pressure. So conclusion today is that, number 1, happy Father's Day next weekend. Number 2 is that you got to talk to your doctor to identify the cause of the problems. medically, there are a lot of things can help you, and naturally, many things can help you improve or even can cure the problems. And so, enjoy the day, and please subscribe. Scroll down on YouTube. Subscribe, and there'll be more coming, like including how to improve lower back pains, cholesterol condition, reverse diabetes. This is Dr. Binyo. Have a great day. Our website is wemedhealth.com, WEMED health.com. You can check out all those informations. Bye.